Hello everyone, my name is Elliot from On Your Game Physiotherapy, and today we're going to be doing a live stream on dealing with ankle sprains and trying to prevent chronic ankle instability. I'm just going to give a couple minutes for people to come in. Any questions you have throughout, please let me know and I'll get through them as I can. Just give it a few more minutes. Perfect, so I'll get started then on today's topic. So as I said, what I'm going to be discussing today is dealing with ankle sprains, as they're a very common injury. It happens a lot of the time, especially to players in sports who are doing a lot of changes of directions and a lot of different kind of movements within the ankle. And again, I'm going to discuss a little bit about what an ankle sprain is, the type of ligaments that can be affected. I'm also going to explain a little bit about different grades of ankle sprains and how they're kind of classified. And I'm also going to touch on the rehab protocol and what to do if you have an ankle sprain and kind of rough estimates of time frames of how long the recovery can take. Again, obviously depending on the grade of the sprain. And then of course the rehab protocol and how to overcome it and prevent it from happening again, because it's a problem that a lot of people can have and it can repeatedly occur. And again, that's kind of where the chronic ankle instability comes in. We want to make sure we strengthen up the ankles, improve the stability to try and prevent this from happening in the future. Perfect, so I'll get started then. So first, we're going to do a really brief anatomy of what surrounds the ankle and what kind of we'll be discussing today. So to start off with, of course, you've got your tibia and your fibula, which are the long bones on the lower portion of your leg, which of course go into your ankle in that portion there. So you also have a range of different tarsal bones. So again, there's lots of different bones within your foot. Again, these are grouped, the tarsal bones, and then you go into your metatarsals, which go down the foot and more into the phalanges as well. So again, these are just the more important bones to be aware of, again, because at times you want to be able to rule out a fracture or anything more serious within the ankle when looking at ankle sprains, just in case there's a fracture in there or anything sort of more serious to look into. Also, we have the muscles of the ankle. Again, a very brief outline because there's loads of different muscles within the ankle. It would take us a long time to go through all of them. So again, the most important ones we're going to touch on is the gastrocnemius, which again is the big calf muscle essentially. Your soleus, which sits just underneath the gastrocnemius. And then also you have your tibialis anterior, which runs sort of down your shins and across your shins. Again, these are all really important as athletes, as anyone sort of recovering from an ankle sprain. It's really important to build these up and strengthen these up, as after an ankle sprain, there can be some weakness within these areas, and it's really important to build that up when looking to return to sport or when looking to sort of get into a full rehab. So again, now we're going to touch a bit on the ligaments. So I'm going to focus a bit more on the lateral ligaments of the ankle, purely because it's the most commonly they're called the most commonly injured ligaments within the ankle. It's a lot more difficult to sprain the medial ligaments, and it's quite rare to have that occur. So just to start, let me just touch briefly on the lateral ligaments. So you have your ATFL, which is your anterior talofibular ligament, which is again the most commonly injured of the lateral ligaments. You have your CFL, which is your calcaneal talofibular ligament, which sits more in the middle. And then you also have your PTFL, which is your posterior talofibular ligament. And again, these are the main sort of ligaments that make up the lateral aspect of the ankle and the most commonly kind of affected injuries when dealing with ankle sprains. So again, sorry, let me just sip some water. So again, we want to make sure that we rule out a fracture or anything serious. Again, it's important that you get checked by a healthcare professional, or if you get checked by someone within the field to make sure that you haven't got a fracture and to rule it out. And these rules are called Ottawa ankle rules, and it was essentially made to stop so many x-rays being performed, as everyone who sort of was thought to have an ankle sprain previously was just given an x-ray to see if there was any breaks there. But now obviously it's expensive and takes a lot of time up to be x-raying everyone. So some rules are made up to sort of rule out people who don't necessarily need an x-ray. And it has a really good percentage rate of ruling out people with ankle fractures essentially. So again, the first point of the Ottawa ankle rules is any bony tenderness along the distal 6 centimeters of the posterior edge of the fibula or the tip of the lateral malleolus. So essentially, any sort of bony tenderness on the top of that bone that sticks out of your ankle, or also into the fibula as well. Next is some bony tenderness along the posterior edge of the tibia and the tip of the medial malleolus. So again, in the medial portion, you also want to be aware if there's any tenderness within the medial malleolus, which is again that bony point, but on the inside of your ankle. You want to be aware of any bony tenderness there, just in case to rule out any fractures. Also any bony tenderness on the base of the fifth metatarsal. So again, that portion is sort of a bit further down the foot and on the outside. But again, it's really important to get checked over by a healthcare professional before kind of making these decisions. Next is bony tenderness of the navicular, which is one of the tarsal bones which sits quite in the middle of the foot. And again, important to get this ruled out. By bony tenderness, it essentially means when you're palpating or pressing on the area, if there's any pain alongside that, or even without palpating, and you genuinely just have pain in that area anyway. Also, the fifth part of the Ottawa ankle rules is the inability to bear weight through the affected leg. So this is either immediately after the injury or for after 4 steps. So if you're being assessed and you're unable to weight bear for 4 steps, then again, it's likely that you might need to get an x-ray just to make sure there's no fractures in there. But again, really important to get that checked out by a physio or healthcare professional before sort of looking deeper into that. But again, that's just some pointers just to rule out any fractures, and now we'll move on a bit more about sprains. So, I'm going to describe a little bit about the classification of acute lateral ankle sprains. And before going on to that, actually, I'm going to discuss a bit about why it's more common for lateral ligaments to be affected rather than medial ligaments. So again, naturally, just with the mechanism of injury, with a lateral ankle sprain is when we go into plantar flexion. So I'm going to show you with my wrist. So when we come into plantar flexion, so the heel is raised, and then we laterally rotate outwards. And of course, the lateral aspect of the ligaments are stretched. So again, that's the most common mechanism of injury. When we say someone rolled their ankle, we think of them coming sort of outwards and rolling it in that aspect laterally. Again, the medial ligaments are less commonly affected, purely again because of the anatomy of the ankle. Again, there's a lot less range of motion within that movement coming in medially. So it's less likely to sprain than medial ankle ligaments in there. Again, because of the structure and the anatomy, there's some bony articulation which also limits that movement and just restricts the movement. So there's more stability within that movement. So you're less likely to have your medial ligaments affected. But now we'll talk a little bit about the classification of ankle sprains and how they're graded. So again, ankle sprains are graded from 1 to 3. 1 is the lowest level of sprain and 3 is the highest level of sprain. So again, we'll start off with grade 1 sprains. So this occurs when the ATFL, as I mentioned before, the anterior talofibular ligament, the ligament that sits across sort of the front and to the side, is when this ligament is stretched and only some of the ligament fibers are torn. So there's no full tear of the ligament. There's nothing that's been ruptured or come off at all. Again, it's just more of an overstretched kind of feeling, and some of the ligament fibers have been affected in there. You'll probably see mild swelling and there'll be little or no bruising. Some people don't have any bruising at all. Some people might just have a little bit, and that will be on sort of the lateral aspect of the ankle. Also, there might be some point tenderness on the ATFL. So again, where the ATFL is located, if you're palpating and pressing on that, and there's some tenderness and some pain with that, again, it's likely that you might have a grade 1 sprain. But we'll go further into the other grades as well, just to rule out anything further. Again, there might be some restriction of range of motion, but there might not be. You might have full range of motion and still have an ankle sprain. But again, it's likely that you might have a bit of restriction within some of the ankle movements. You also might have difficulty with full weight bearing. So again, even though you will be able to walk and mobilize, it might just be a bit difficult. You might have a limp and might be a bit painful when you're putting weight through the ankle. And there'll also be no laxity on examination. So laxity is essentially how far a ligament can stretch. So again, if you've had a severe sprain to one of your ligaments, there's going to be some laxity in there, meaning it's just going to move a lot further past the range it should be in, and there's a little bit of laxity within that movement. And in terms of grade 1 ankle sprains, a lot of people go back too soon, and then again, they're going to be at more risk of chronic ankle instability. But usually it's around a 4 to 6 weeks point before you make a full recovery. And I'm going to discuss the full rehab protocol further down the line, just so we can sort of make sure that we're fully rehabbing and making sure that the ankle is strong enough and stable enough to be able to return to sport or return to your day-to-day life and prevent that chronic ankle instability from occurring or repeated ankle sprains from occurring. So next we have a grade 2 ankle sprain. So it will be moderate injury to the lateral ligamentous complex. So again, in grade 1 injuries, there's only sort of partial tearings and some small ligament fibers that are torn. There's just a lot more fibers that have now been torn. But again, we're at the midpoint, so there's not been a full rupture or tear of the ligament. It hasn't completely come off, but it's been overstretched a lot more, and more fibers have been affected than a grade 1 sprain would. Frequently, sort of within these grade 2 ankle sprains, it can be sort of either a complete tear of the ATFL and a partial tear of the CFL. And you're going to have a lot of restricted range of motion. There's going to be some localized swelling and bruising in there as well. So again, it's likely that your ankle is going to swell up quite a lot. There's going to be a lot of fluid within there, and there's going to be some bruising as well. Again, this is an inflammation process to try and help with that healing process. Again, within that fluid, within the reason why it's swelling up so much is to allow for all of the nutrients, the white blood cells and everything to come into the area to try and heal it and help. And again, it's likely that you'll see that swelling come up instantly after it happens, as the response is quite quick. Again, you might have tenderness of sort of the anterior aspect of the ankle. So on the side of the ankle, this might be tender across sort of the whole portion of the lateral aspect, and especially when you're palpating and sort of pressing on the ligaments. Again, there might be some abnormal laxity within there. So with grade 1s, you might not have any laxity within the ligaments. But on grade 2, it's likely that you're going to see some laxity of the ligaments within that range. But again, it might be absent. There might not be any laxity. And in terms of in the acute settings, when it first happens, it's quite difficult to differentiate between a grade 2 and a grade 3 within that acute setting when it's just happened. So sometimes you might need to get checked over by a health professional just to make sure that there's no further issues within the ankle. And again, usually with grade 2 ankle sprains, it can take up to sort of 6 to 8 weeks for a full recovery. And when I say full recovery, I mean being able to tolerate them full loads of sport and being able to fully tolerate the change of directions and all of the demands of what that sport takes, because again, we don't want another ankle sprain occurring. And again, it's likely that this can repeatedly happen if you fail that rehab and go back a bit too soon. So now moving on to a grade 3 lateral ankle sprain. So this is a complete disruption of the ATFL and the CFL, and also there could potentially be a capsular tear within there, and you might also have all the ligaments affected. So when an ankle sprain happens when it's grade 3, it's likely that you've affected more than one ligament, and again, it's likely that there could be a full rupture or a tear where that ligament is actually disconnected, and again, it's going to be a longer recovery time for this. So in terms of sort of the signs you might see for a grade 3, there'll be a lot of swelling, a lot of bruising on the lateral side of the ankle in the heel, and there's going to be a vast amount of tenderness across the lateral aspect as well, and that's going to be on the ATFL and the CFL. Again, this is quite similar from a grade 2, so you just want to make sure to differentiate that. It's quite difficult to do in the acute setting, but again, want to make sure that we stabilise that ankle and we really start to progress onto that rehab as soon as possible to try and help with sort of the inflammatory effects straight away, but also to instantly build up that strength and range of motion. Again, you're going to be quite limited on range of motion. There's also going to be some laxity present because, again, as that ligament has torn and come off, there's going to be laxity and it's going to be able to move a lot further, essentially. And in terms of recovery times for this kind of injury, usually can take up to about 10 to 12 weeks overall. And again, these recovery times can differ from person to person, but it's important to go through the full rehab protocol and do testing throughout to make sure you're able to tolerate that. And that's what we're going to move on to next. So the first few days after you've had a sprained ankle, the most important thing is to rest and not perform any sort of sports or running based activity or any heavy loading based activity. Again, there's no harm in starting some exercises off straight away to try and improve that range of motion if it's been lost, but also it's really important to help with that swelling and that inflammation. So again, icing has been shown that it's not as beneficial in the acute setting anymore, purely because we want that inflammation to occur. We want to be able to get all them white blood cells and nutrients, as I mentioned, into that area to try and allow that healing to take place. Some of the icing and putting icing on the area can just limit that a little bit and prevent some of the natural inflammation from occurring. So again, for the first few days, if you have restrictions to the range of motion, it's important to get that range of motion back first. This is also going to help with pain levels, but also going to help to allow that inflammation to occur again as well. So again, you can walk as able, and avoid doing things that aggravate the pain or make the swelling worse. So again, excessive walking for long periods can cause it to swell up a little bit more, or doing a bit too much on the ankle can cause that swelling to increase. So again, it's important to pace yourself and manage what you can tolerate on the first couple of days. So again, some active range of motion exercises are going to be really important. So that can include just moving the ankle up and down like that, and also moving the ankle inwards and outwards in that range. Another good exercise to do as well is by using a resistance band, putting it around your foot and just pumping up and down like you're pumping on a pedal. What that can do is allow for the calf to work a bit like a pump and pump some fresh blood within to the area, helping with some of that healing process. But again, it's a very low level strengthening exercise to try and get some of that movement and strength back within the ankle straight away. And again, you're not weight bearing through it, so it's a bit easier to do straight away. So before progressing to the next level, we want to reduce that swelling and we want to achieve full range of motion to be able to progress and really work through the protocol. So to start off with some low level strengthening exercises, of course, we've done some of the ankle pumps, but now we want to be doing some seated calf raises. So in a seated position, what you want to do is just raise the heels up and down. Again, this is something that you can do little and often throughout the day. Again, trying to pump some fresh blood into that area, but also starting to strengthen up the ankle a little bit. When that becomes a little bit easier, you also want to implement some seated tibialis raises. So that's just where before we've been doing the heel raises, it's just going in the opposite direction and rising the toes off of the floor and holding to try and squeeze the tibialis anterior muscle. Again, that's going to be really important to try and build the strength within your ankle, because we want to be working opposing sides in there. Then once we're able to tolerate them exercises with no pain and we're able to perform that quite well, what we're going to do is progress to standing and weight bearing exercises. So this is going to be done on both legs. So again, we're moving from a seated position in the calf raise to now a standing calf raise. And again, we're going to be weight bearing a little bit more through that. Again, holding onto a surface in front of you can be quite beneficial when you're doing the standing calf raises, because if you're still a tiny bit restricted on that range of motion, you can push yourself up to try and get that full range of motion. Again, really good for strengthening up the ankle. Next is going to be some single leg stands. So again, balance and stability are really, really important when recovering from ankle sprains, because that stability is what the ligament provides. And again, where you've rolled your ankle in a certain way, there must have been some sort of limitations in stability prior to that, unless there was sort of a really excessive force. But again, commonly people sprain their ankles just from running. And again, we need to have that stability in place to limit that rolling kind of mechanism and prevent that from occurring. So again, a single leg stand is a good way to start that. If you've had an ankle sprain, it's likely that if you test yourself from right to left, the one that's affected is going to be a lot worse of balance. You're going to be wobbling around a lot more. But then little wobbles and changes that you see when you're standing in that position, that's the ligaments working and working away with something called proprioception. And proprioception is essentially our body's ability to know where it is in space and where our limbs are in space. So the little wobbles within your foot as you're trying to maintain that balance is the ligaments and all the surrounding areas of the ankle working to try and stay nice and stable. And that's going to be really important in the rehab process. So again, what we also want to start moving on to is some resistance banded inversion and eversion, and that's just moving the ankle inwards and outwards as well. So again, we're trying to strengthen the ankle up in different ranges, not just up and down essentially. So testing must be completed on the standing weight bearing exercises, and we want to be able to achieve sort of a good amount of reps without any pain. So ideally, sort of being able to achieve 15 to 20 reps minimum to be able to start to progress to the next phase. And again, we don't want much pain to be occurring in this phase. Again, some slight discomfort is normal, but we want to be sort of easing out the pain a little bit at this point. So next, it's important to progress to some unilateral strengthening exercises. Essentially, what that means is just doing it on one leg. So again, what we want to be able to do is match the reps on each side. So we want to be able to do 12 reps, for example, on the right side and 12 reps, for example, on the left side. If you have had an ankle sprain, it's likely that there's going to be a lot of weakness within the affected side. So again, we want to be able to make sure that they're equal in strength before moving forward, because any sort of imbalances in there is just going to put you at more risk moving forward of further injuries. And we want to continue to make these exercises more challenging. So the single leg calf raise is a really good exercise to progress. So from the point when you're able to achieve a certain amount of reps, we can start to add some weight or increase the reps just to make the intensity a little bit harder and challenge that a bit further. Also, we want to make the balance and stability exercises more difficult as well. So in order to do that, we want to go from just that single leg stand to position to then doing it with our eyes closed, and then again progressing more onto a Bosu ball or a pillow or something that's more difficult to stand on to really try and challenge that stability. So again, before we move forward onto the next phase, we want to make sure that we can complete equal reps on both sides. So again, aiming for sort of 15 to 20 reps on each leg, doing a single leg calf raise. Once we're sort of equal in strength from that position, we can start moving on to some plyometrics. And plyometrics essentially sort of jumping and hopping based movements. And it's going to be really important when returning to sport, because at this point, this is where a lot of people sort of stop the rehab process, and they feel like they've done a lot of the strengthening and the ankle is equal in strength. But again, being able to tolerate loads that you're going to go back into for sport. Again, if you've had an ankle sprain and you've been out for 4 weeks, it's been a while since you've done a lot of hopping, jumping, and anything that's related to your activity. So it's going to be important to start with some low level stuff. So some exercises include low level ankling, also some pogos as well. So that's on both legs, hopping up and down, and going on to some low level hopping as well on a single leg. If there's no pain and we can tolerate these quite well, then it's important to start progressing to the next phase. And now, again, similar to the strengthening exercises, we're going to move on to more single leg based exercises. So that can be single leg hopping, we can do some box jumps, single leg vertical jumps, and single leg distance jumps. Again, we want to be comparing both sides and testing that we're sort of equal within ability to be able to continue moving on through the phases. But again, it's going to be really important to challenge yourself in different directions, different sort of capabilities of what you need to do, whether that's jump up really high or jump up for distance, because again, in sport, there's a lot of different things that you're going to be doing within the sport, and a lot of different demands that you're going to have. You're also going to have a lot of adrenaline whilst playing and returning to sport. So again, you're going to be more likely to be in a position where your ankle could get sprained, because you're less aware of where that ankle is in space. So it's important to really build that up and be able to tolerate that well. And after we're, again, sort of equal on both sides of plyometrics, so that's, again, trying to aim up to even 50 single leg hops per side, really being able to do that, because, again, when you're running, it's sort of like repetitive little hops on both sides, so it's really important that we can maintain that and match that on both sides. So, again, the last phase now will be, we've come to a good position, we're able to hop on both sides, both the same, and we're able to now gradually return to sport and return to running. So to gradually return to running, what we want to start off by doing is just gradually increasing the intensity of running, starting off with sort of, even if it's 500 meters, then building to 1,000 meters, and slowly and gradually building that up. But we want to make sure that there's no pain throughout doing the running, and no pain or discomfort whilst running, to be able to tolerate that. And again, just gradually building that up as pain allows, leaving some rest in between, to build up that intensity and allow you to gradually return back into sport. It's likely as well that if you have had an ankle sprain, your fitness might have reduced a little bit. So again, that can be included in the return to running kind of protocol. And then now what we also want to be doing is some sport-specific plyometrics. So again, jumping from side to side. If you're, for example, a rugby player and you're going to have to jump up high to catch a ball, or if you're a basketball player and you're going to have to jump up to make a layup, again, challenging these positions that you might be using in sport is going to be really important to be able to get back to that sport safely and effectively. Because as I said, if we're returning to sport when our ankles have been a bit weaker and we're not able to tolerate the demands of the sport, then we're going to be at more risk of an injury. So again, relating that a bit more to sport, if, for example, you're someone who's playing football, for example, and you've got to change directions quickly, we want to make sure you can gradually build up and tolerate being able to change directions at speed whilst decelerating, because again, that's a common kind of mechanism of injury for ankle sprains. But it's really important that we're able to tolerate that before going back to sport, to ensure that it doesn't happen again and to prevent that the chronic ankle sprains. And again, if you're someone who has been dealing with sort of chronic ankle sprains or repeated ankle sprains, go into a position where you're really strengthening that ankle. I would test yourself out to see whether you're equal on both sides on strength, because it's likely that if you are someone who has repetitive ankle sprains on one side, test yourself out on a single leg calf raise, trying to do 20 on each side might be a bit more difficult on that affected side. Or again, if you're someone who has got equal strength, but you have been still suffering from repeated ankle sprains, try hopping on one side and then repeating on the other side. Again, it's likely that it might be more difficult on that side that has been affected more, just where there's some limitations in stability and also some strength and some balance within the ankle as well. And again, that is kind of a full rehab protocol, a brief outline of what it would look like before returning back to sport, and why it's so important to be able to tolerate all these things before going back to sport and making the most of your return. Because again, it's very likely that it can occur again if you return too quickly, and that ankles will be in a bit more of a vulnerable position moving forward. If there's any questions, please pop them below. Again, that was a very fast and brief outline of ankle sprains. There is a lot more to sort of delve into. But if you do have any questions, please pop them in here and I'll get them back to you, even if it's in the comments after this video has gone up. If you are someone who's suffering with chronic ankle sprains or repeated ankle sprains, or you've just had an ankle sprain, feel free to come into On Your Game clinic and we can get you sorted and really get you started on this rehab protocol to try and improve that ankle strength. But again, everyone is different in terms of how they recover. Some people might take a little bit longer, some people might take a little bit quicker. But again, the protocol is the same. We want to be able to build up on all these kind of metrics that I've mentioned to try and make the most out of your recovery and prevent this from happening again in the future. Perfect. I'll leave it a couple seconds if there's any questions. But other than that, that is all finished for today. Again, any questions, even after this has been uploaded, please feel free to comment them down below. Thank you everyone for watching, and I'll see you in the next one. Bye.